medical device that allows the user to recap but keeps their hands safely away from the needle. Disposable needles, syringes, blades, broken instruments, or anything that might lacerate the skin should be immediately discarded into a sharps container after use. Contaminated reusable sharps should be placed in a puncture-resistant, leak-proof container. The container should be identified as biohazardous until the items are properly sterilized. One of the best ways to prevent exposure to blood or other infectious materials is to clean with an appropriate disinfectant. It can't be overemphasized that the proper use of disinfectants is critical in healthcare facilities. The best way to ensure that you're using disinfectants properly is to frequently consult and review the manufacturer's instructions that accompany the product. Disinfectants that are used in medical or dental facilities should perform two important functions. They must be bactericidal, which means they kill harmful bacteria, and fungicidal, which means they kill fungus. Products that perform both these jobs are referred to as hospital-grade disinfectants. Disinfectants used in your facility should be EPA registered. It's important to pay special attention to the section titled Special Instruction for Cleaning and Decontaminating Against HIV-1 and HBV of surfaces, objects soiled with blood or bodily fluids. Well, we've discussed ways to help minimize the likelihood of exposure to blood, but no matter how careful you are, accidents can happen. If you have an exposure incident, you have the right to immediate medical attention. Any exposure incident should be reported to your safety and health manager as soon as possible. These forms are used to document exposure or sharps injuries in your workplace. They should be completed as soon as possible after an exposure incident. These forms are important. They document the exposure, allowing management to implement change if necessary to avoid a similar accident in the future. But it also provides permanent documentation in your employee medical record in case there are complications down the road. Remember, if you have an exposure involving blood or other infectious material, you have the right to immediate medical attention at no cost to you. You have a legal obligation to ask the source patient, if known, to consent to a blood test as well. Ideally, both the exposed employee and the source patient get tested. If the source patient's blood comes back negative, that's the extent of testing, and the employee has closure and peace of mind, usually within 15 days. If the source is unknown or refuses to test, testing is normally carried out over a 6-month period. This normally includes the baseline and then follow-up testing at 6 to 8 weeks and the final test at 6 months. OSHA currently enforces whatever the CDC recommends for post-exposure prophylaxis. If you have any questions about your facility's protocol for exposure incidents, talk to your safety and health manager. OSHA defines a hazardous chemical as any element, chemical compound, or mixture that is a physical or health hazard. Their hazard communication standard is designed to ensure that information about these hazards and associated protective measures are conveyed through safety data sheets, labeling, and routine training. Almost every healthcare facility or dental facility have chemicals that could potentially be dangerous to you or other employees if not used properly. Cold sterilization, X-ray chemicals, injectables, these are just a few of the potential hazardous chemicals you may be exposed to. Under OSHA's hazard communication rule, employers must have a written hazard communication plan, identify and convey warnings on chemicals taken from their original containers, provide safety data sheets or MSDSs for all chemicals and professional products, and to train employees on their use. You can find your hazard communication plan in your OSHA Guard manual or with your OSHA written plans. This plan shows how hazard communication compliance is achieved in your facility. Your employer also has the responsibility of identifying chemicals and conveying any warnings associated with the chemical if required. The label on this bottle properly identifies the contents as isopropyl alcohol. The name of the manufacturer and the appropriate warnings are conveyed. In this case, the manufacturer has adequate warnings on the container and nothing needs to be done. However, if the alcohol is poured out of the original container or into a secondary container, then it's important to affix a label that identifies its contents and any warnings associated with the product. Hazard rating labels are a great way to easily convey the contents and warnings of products taken from their original containers. Proper labeling ensures not only that the product is handled and stored properly, but also provides information which is important in case of an accident. This hazard rating chart, or one like it, should be posted somewhere in your facility. In March of 2012, the Hazard Communication Standard aligned with a globally harmonized system. This alignment changed the way chemical hazards are conveyed and the format content of MSDS sheets. Previously, The common method for rating chemicals were the NFPA and HMIS rating systems. These systems use a combination of colors and numbers to identify physical or health hazards. The alignment with the Globally Harmonized System, or GHS, introduced 9 pictograms as the new, globally recognized standard for conveying hazards. Any of the 3 hazard rating systems are acceptable until the final implementation date of June 1, 2016. At that time, GHS will be the only acceptable rating system. As I previously mentioned, the NFPA symbol uses a combination of colors and numbers to convey hazards. The blue field represents a health hazard, red indicates a fire hazard, yellow a reactivity hazard, and the white field is used for special warnings. Since there are no numbers, the product would be considered non-hazardous. If there were hazards, numbers from a 1 to a 4 would be placed in the appropriate field. A 1 indicates a slight hazard, 2 a moderate hazard, 3 a serious hazard, and 4 would convey a severe hazard. This is the manufacturer's ratings for isopropyl alcohol. The 1 in the blue field would identify the product as a slight health hazard. The 3 in the red would identify the product as a serious flammability warning. The newly adopted system uses pictograms to convey these warnings. The following 9 pictograms represent the new standard. Skull and crossbones, exclamation mark, corrosion, health hazard, flame, flame over circle, gas cylinder, exploding bomb, environment. These pictograms represent a physical hazard, health hazard, or environmental hazard. Since OSHA is only concerned with employee safety, only the first 8 were adopted, since they represent an actual risk to employee health. The environmental does not present a risk to employee health, but will be enforced by local agencies, since specific disposal requirements would be required. As of December 1st, 2015, distributors can't ship container labels unless they use a GHS label. This GHS label has a few important elements you should be familiar with. The top left corner is the product name or product identifier. Field 1 is the signal word. The signal words used are danger and warning. Danger is used for more severe hazards. Field 2 is hazards conveyed with pictograms. Field 3 is your hazard statement, which describes the nature of the hazard. Field 4, the precautionary statement, which describes recommended measures to prevent or minimize effects from exposure. And Field 5 is distributor or manufacturer information. If you have any questions about products used in your facility, reference your MSDS book. A Material Safety Data Sheet, or MSDS, contains detailed information about a chemical's hazardous components, physical and chemical characteristics, and safe practices for using it. Your MSDS book should be organized and have a master list in the front of the book, inventorying all of your MSDSs on file. This allows for quick reference if needed for an emergency. This is your standard MSDS sheet for isopropyl alcohol. There's no set format with an MSDS, but they contain the same information. Some of the information you can find would include the product identity, physical and health hazards, first aid procedures, how to clean up spills, and personal protective equipment. When the Hazard Communication Standard aligned with Globally Harmonized System, it not only affected the rating system used to convey hazards, but it also initiated change to the existing MSDS format. One of the most basic changes was dropping the M in Material Safety Data Sheet. They will be referred to as SDSs or just safety data sheets in the future. The biggest change was mandating a uniform 16-field format for the new SDSs. The new format must be adopted by manufacturers by June 1, 2015. The 16 fields will be the same for all manufacturers and include the following information in order: product identification, hazardous ingredients, composition or information on ingredients, first aid measures, firefighting measures, accidental release measures, handling and storage, exposure control and recommended personal protective equipment, physical and chemical properties, stability and reactivity, toxicological information such as symptoms and exposure effects, ecological information, disposal considerations, transport information, regulatory information, and other information. Once again, the June 1, 2015 deadline is for manufacturers Changes such as labeling and updating hazard communication policies in your workplace aren't required until the final implementation date of June 1st, 2016, the final date for employers to get into compliance. Tuberculosis is an airborne disease that may present a risk to some healthcare workers. Your degree of risk is dependent on a few factors, including the prevalence of TB in your community, the number of cases treated in your facility, and the types of procedures you perform. The majority of medical and dental facilities would be classified as low risk. If your facility doesn't admit or treat patients with active TB, you're not required to have specific engineering controls in place. However, it's always a good idea to have a small supply of specialized personal protective equipment, such as a box of N95 respirators in case you suspect a potentially infectious patient. The prevalence of TB is low in the U.S. According to the CDC, in 2011, the national average was 3.4 cases for every 100,000 residents. This represents a rate that is 6.4% lower than 2010. This is the lowest rate recorded since national reporting began in 1953. Although your risk is low, it's important to be familiar with the symptoms of active TB. The symptoms include a prolonged cough that lasts 3 weeks or longer, many times producing bloody sputum or bloody phlegm, fatigue, fever, night sweats, chest pain, and weight loss. If a patient admits having active TB, or you suspect they might be infectious, they should be referred to a local admitting facility that is equipped to deal with tuberculosis. Treatment should be deferred until the patient is no longer infectious. Some larger facilities, pulmonary and infectious disease specialists, and any other specialties that admit and treat patients with TB obviously have a higher risk of exposure. These facilities would be obligated to provide routine testing, specialized personal protective equipment, and fit testing on a routine basis. If you have any questions about tuberculosis, site-specific policies or testing, talk to your safety and health manager. Medical waste is any waste that may present a threat of infection to humans. Although lots of people refer to it as medical waste, it's also commonly called infectious, biomedical, or regulated waste. The Bloodborne Pathogen Standard classifies these wastes as contaminated sharps, items contaminated with blood or other potentially infectious material, and which would release these substances in a liquid or semi-liquid state if compressed, items that are caked with dried blood or other potentially infectious material and are capable of releasing these materials during handling, pathological and microbiological waste containing blood or other potentially infectious material. These wastes need to be segregated and disposed of as close as feasible to the immediate area where the waste was generated. This is referred to as point of origin disposal. Items classified as sharps should be placed immediately into a puncture-resistant, leak-proof sharps container. These containers should be identified as biohazardous with the label and fill line clearly visible. If wall-mounted, sharps containers should be located at a comfortable, safe height for everyone that uses them. All other medical waste, including soft absorbent and non-absorbent waste, should be disposed of into a red bag. These bags are specially designed to be tear and puncture resistant and are identified with the biohazardous symbol. Red bag waste would include gauze, dressings, visibly contaminated gloves, or any other soft waste saturated with blood or other potentially infectious material. Most facilities have a final destination storage area where red bags and full sharps containers are brought for off-site transport. This area should be identified as biohazardous and should be in an area out of the flow of patient traffic. Additionally, the final destination box should be stored on a non-absorbent, easily cleanable surface. Any records of off-site transport or pickup receipts should be kept for a minimum of 3 years. Although OSHA enforces regulations that keep employees safe, such as requiring point of origin disposal and the use of personal protective equipment when handling medical waste, it's the individual states that dictate the laws relating to disposal of these wastes. Some states require a transporter and some don't. If you have questions regarding the disposal of medical waste, you should reference your state's specific regulations. An internet search with the name of your state and medical waste is usually a good place to start. The Environmental Protection Agency also has a great site with regulations available for each individual state. The first step in responding to a blood spill is to select and wear the appropriate personal protective equipment. Remove any sharp objects such as broken glass or needles. Don't use your hands. A broom and a dustpan, tongs or a forceps should be used to avoid injury. If the spill is on a non-absorbent surface, the area should be covered with bleach. Cover the area with an absorbent material such as paper towels or kitty litter. This absorbent material should then be disposed of into a red bag along with your gloves. A new pair of gloves should be worn, and the area should be cleaned with warm soap and water or an all-purpose cleaner. An EPA-registered disinfectant should then be sprayed on the area and allowed to sit for the manufacturer's recommended contact time. The area should be then dried with paper towels, and all cleanup materials should be properly disposed of. Finally, remove your gloves and thoroughly wash your hands with soap and water. I said in the beginning of our training that your employer has an obligation to provide a safe workplace, and they do. But you have an obligation as well, and that's to follow your employer's program. With that said, this concludes my role in your OSHA training. If you have any more questions about policies, talk to your safety and health manager or reference your OSHA Guard manual.